Overview to borderline personality disorder. Borderline personality disorder, often referred to as BPD, is a mental health disorder that significantly affects an individual's feelings toward themselves or others. Borderline personality disorder may impact your life on a daily basis, making seemingly simple choices result in doubting yourself or self-worth. A common and reoccurring internal dialogue of negative thoughts and feelings is symptomatic of borderline personality disorder. Besides the internal struggle individuals with borderline personality disorder face, there is also a harsh reality of stigmatized misconceptions of the disorder. In an effort to destigmatize what has been socially constructed, it is crucial to acknowledge and understand that having a personality disorder does not mean that there's something wrong with your personality. Rather, the disorder has developed a pattern of feelings and thoughts that, over time, have caused you problems. In this video, we'll delve into these areas specifically: symptoms, diagnosis, and treatment. Symptoms. As mentioned, borderline personality disorder affects relationships with others as well as with yourself. Struggling long-term with rapid mood changes of extreme highs and lows, unable to control negative or hurtful behaviors, having difficulties trusting others, and/or finding yourself acting impulsively makes retaining and sustaining healthy relationships very difficult. Although individuals with borderline personality disorder want and would benefit from long-term, meaningful relationships, self-destructive patterns become barriers to healthy relationships. Fearing abandonment, a pattern of erratic relationships, both private and professional, are rooted in extreme and unregulated emotions. Along with fears of isolation, individuals with borderline personality disorder are also known to engage in self-destructive behaviors, ranging from self-harm, suicide attempts, to death by suicide. A key component in prevention is awareness of signs and symptoms. Here is a list of what to look out for. Unstable or volatile relationships, both professional and personal. Fear of abandonment, going to extreme measures to avoid separation. Unstable emotions, frequent and intense emotional extremes lasting hours to days. Unstable identity, unclear sense of self. Rapid changes, quickly shifting goals and values. Impulsive behavior, irrational decisions without contemplating consequences. Self-damaging behaviors, self-injury or suicidal behavior. Unstable thinking, suspicious of others or alienating tendencies. Stress-related paranoia, lasting minutes to hours. Intense anxiety, irritability, or depression. Trouble controlling anger. Self-sabotage, quitting a good job or ending healthy relationships. Feeling unfulfilled, ongoing feelings of emptiness. At this point, you may be asking yourself, when should I see a doctor? If any or all listed characteristics of borderline personality disorder above are something you've experienced, speak with your doctor or a mental health provider near you. Do not allow stigma or negative thoughts to prevent you from seeking the advice of a professional. What are the risk factors for borderline personality disorder? They include hereditary predisposition, if an immediate family member has the same or similar disorder. Age, usually beginning in adolescence and early adulthood, diagnosis is usually made in your 20s. Stressful childhood. Physical or sexual abuse or neglect can be contributing factors to the disorder. Personality. Traits including aggression and impulsiveness may contribute to the disorder. Other mental illnesses. Many with borderline personality disorder also suffer from other mental illness, making it harder to diagnose. Diagnosis. If you have borderline personality disorder, or think you might, do not get discouraged. Many people with borderline personality disorder are capable of recovery through proper diagnosis and treatment. As a result, People can manage and balance their emotions and thoughts more regularly. Generally, beginning in adolescence, the diagnosis is not a life sentence. Many people go on to lead productive and fulfilling lives. For the best chance at long-term success, a valid diagnosis by a trained professional is necessary. If this description of borderline personality disorder aligns with what you have been feeling or thinking, do not self-diagnose. Please visit your doctor or a local medical clinic if you are concerned. It may seem like a simple checklist or classification. However, the process of being diagnosed with borderline personality disorder is extensive. Treatment. 1. Self-help. By watching this video, you are already taking the first step towards self-help. You are learning about BPD, and by doing so, you are more likely to recognize patterns in yourself, understand what's happening with you, and why. 2. Professional help. There are multiple options when it comes to therapies. A. Dialectic behavior therapy, DBT, is the most popular choice because it teaches you how to focus and remain present. This therapy option is consistently ongoing. B. Mentalization-based therapy helps you recognize yourself in relation to others. This method is key in analyzing unhealthy as well as healthy relationships with yourself and others. C. Interpersonal group therapy encourages sharing and listening in a group setting. This will develop self-esteem and trust, both inhibited by BPD. D. Family therapy is very helpful on a personal level and can deliver coping skills for both you and your family. E. Connection to a therapist via phone or email can be incredibly helpful in moments of doubt or frustration where support networks are unavailable. Medication. Medication is not the answer when it comes to borderline personality disorder. Although medication may help manage some of your symptoms, such as mood stabilizers and antidepressants, self-help and therapies develop a foundational and sustainable skill set to ensure long-term wellness. Remember, borderline personality disorder is not a life sentence. Take the next step to wellness by contacting your family doctor or by gaining more information. For more information that you can trust, please visit www.heretohelp.bc.ca. If you are having suicidal thoughts, please call toll-free in BC 1-800-SUICIDE. This has been a presentation of the Mood Disorders Association, a site of Lookout Housing and Health Society. Thank you for watching.